Hello, I'm Dr. Sachin Kotashtane, and on behalf of Lotus Medics, I'm going to talk to you today about endometriosis. What is endometriosis? Endometriosis comes from the word endometrium, which itself comes from the word endo, which means inside, and metros, which means uterus. So the cells of the inner lining of the uterus, which are called endometrium, when cells which are similar to these cells are present inside the body, inside the peritoneum, and in the lining of the pelvis, that is called endometriosis. This is an inflammatory condition which can significantly affect the quality of life for women and girls. Endometriosis affects millions of girls and women at every age across the world. It costs billions of dollars in lost productivity, but the biggest loss is the affection of the quality of life of women. About 1 in 9 women in the world are affected by endometriosis, and it can take as much as 7 years between the onset of symptoms and someone to get treatment. This is because the symptoms of endometriosis are often varied and can often lead to difficulty in diagnosis. What are the symptoms of endometriosis? Well, the biggest symptom and the main symptom of endometriosis is actually pain and pelvic pain. Pain in the lower part affecting the bladder, the bowel, as well as the reproductive organs. This is usually cyclical and is seen usually as period pain or menstrual related pain. Sometimes some women can have ovulation pain, which occurs in the middle of their cycle. In other instances, endometriosis can also affect the bladder and bowel, and some women can have pain as a result of opening their bladder, and often thinks this is as a result of a urine infection. Multiple tests indicate, however, that there are no urinary tract infection. Some women also have pain during opening their bowels, especially during a period. Often, endometriosis can also have symptoms of irritable bowel, and some women can have bloating and alternating bowel habits, sometimes constipation and other times diarrhea. Sexual intercourse can also be extremely difficult, and so can pelvic examinations, including obtaining pap smears or a gynecological examination. Often ultrasound scans can be extremely tender, especially internal ultrasound scans, as they can trigger the pain due to endometriosis. In other instances, endometriosis can also present as difficulty to get pregnant or difficulty to conceive. And it's not unreasonable for someone who has been trying to get pregnant for a long time, if they have pelvic pain, to be investigated for endometriosis.